If you are pregnant after 35 or planning to be, this video could be the most important thing you watch during your entire pregnancy. Because advanced maternal age comes with real risks, real challenges, and real decisions that most doctors simply do not take enough time to explain to you properly. I am Dr. Naomi Bennett, and I specialize in maternal and child health and pregnancy. Today, we are talking about advanced maternal age pregnancy, what it means, what the real risks are, what tests you need, and exactly how to have the healthiest possible pregnancy after 35. Advanced maternal age, or AMA, is the medical term used for any pregnancy where the mother is 35 years or older at the time of delivery. Now, before you panic, being 35 or older does not mean you cannot have a healthy pregnancy and a healthy baby. Millions of women do it every single day. What it does mean is that your pregnancy requires closer monitoring, more targeted testing, and a care team that understands the specific challenges that come with pregnancy after 35. The good news is that women today are healthier, more informed, and better supported than ever before, and that makes a significant difference. You might be wondering why 35 specifically. Why not 34 or 36? The answer is that 35 is not a magical cliff edge where everything suddenly changes overnight. It is a statistical threshold based on population-level research showing that certain pregnancy risks begin to increase more noticeably from this age onward. The most significant factor is egg quality. Women are born with all the eggs they will ever have, and as we age, those eggs age with us. By 35, the proportion of eggs with chromosomal abnormalities begins to rise more steeply, and this is the primary driver of increased risk in pregnancies after 35. Let us talk about fertility first, because getting pregnant after 35 is the first challenge many women face. Fertility naturally declines with age, not dramatically overnight, but gradually and consistently from the late 20s onward. By 35, the monthly chance of conception for a healthy couple is approximately 15 to 20% per cycle, compared to around 25 to 30% in the mid-20s. By 40, this drops further to approximately 5% per cycle. This does not mean you cannot get pregnant naturally after 35. Many women do, but it does mean it may take longer, and fertility support may be needed sooner than you expect. The most well-known risk associated with advanced maternal age is an increased chance of chromosomal abnormalities in the baby, the most common of which is Down syndrome, also known as trisomy 21. At age 35, the risk of Down syndrome is approximately 1 in 350. By age 40, it is approximately 1 in 100. By age 45, it is approximately 1 in 30. Other chromosomal conditions, including trisomy 18 and trisomy 13, also increase with maternal age. These numbers sound frightening, but it is important to remember that the majority of babies born to mothers over 35 are completely healthy. What these statistics mean is that screening and testing become more important, not that a healthy outcome is unlikely. This brings us to one of the most important sections of this video: prenatal screening and diagnostic testing. There are two categories. Screening tests tell you the probability of a chromosomal condition. They do not give a definitive diagnosis. Diagnostic tests give a definitive yes or no answer, but carry a small risk of miscarriage. Screening options include the combined first trimester screen, a blood test, plus nuchal translucency ultrasound, done between 11 and 14 weeks, and cell-free fetal DNA testing, also known as NIPT, or non-invasive prenatal testing, which can be done from 10 weeks onward and has very high sensitivity for Down syndrome and other chromosomal conditions. Diagnostic options include chorionic villus sampling, CVS done between 10 and 13 weeks, and amniocentesis done between 15 and 20 weeks. Both give definitive chromosomal results. The decision of whether to screen, which tests to choose, and what to do with the results is deeply personal, and you should never feel pressured in either direction by anyone, including your doctor. Beyond chromosomal risks, advanced maternal age is associated with several other pregnancy complications that require closer monitoring. The risk of miscarriage is higher, approximately 20 to 25% at age 35, rising to 40% or more by age 40, compared to approximately 10% in women in their 20s. The risk of gestational diabetes is higher. We covered this in a previous video, and the management principles are the same regardless of age. The risk of preeclampsia is higher again. We covered this in detail previously. The risk of placenta previa and placental abruption is slightly higher. The risk of preterm birth is slightly increased. The likelihood of carrying multiples twins especially increases with age due to natural hormonal changes that can cause multiple eggs to be released in one cycle. And the cesarean section rate is significantly higher in women over 35, partly due to the complications above and partly due to clinical decision-making patterns around older mothers. If you are pregnant after 35, your antenatal care will and should look somewhat different from a younger woman's pregnancy. You will likely be offered more frequent ultrasound scans, particularly growth scans in the third trimester, to monitor your baby's size and placental function. You will be offered prenatal screening and potentially diagnostic testing as discussed. Your blood pressure and urine will be monitored more closely at every appointment for signs of preeclampsia. You will be screened for gestational diabetes, typically with the glucose challenge test between 24 and 28 weeks. Your care team may recommend delivery before 40 weeks in some cases, depending on your individual risk profile. And you should feel empowered to ask questions, request additional tests, and advocate for yourself at every single appointment. Now let us talk about something that does not get discussed enough: the very real advantages of pregnancy after 35. Women who have babies later in life tend to be more financially stable, more emotionally mature, and more intentional about their parenting. Research actually shows that children of older mothers tend to have better educational outcomes. Advanced maternal age is a medical classification. It is not a judgment on your readiness, your capability, or your capacity to be an incredible mother. There are several things within your control that significantly impact the outcome of a pregnancy after 35. Taking folic acid, ideally starting at least 3 months before conception and continuing through the first trimester, is non-negotiable. Maintaining a healthy weight before and during pregnancy reduces the risk of gestational diabetes, preeclampsia, and cesarean delivery. Regular moderate exercise, walking, swimming, prenatal yoga supports healthy blood pressure, healthy weight gain, and better labor outcomes. Avoiding smoking, alcohol, and recreational drugs is critical. Their harmful effects are amplified in pregnancy, and even more so in older mothers. Managing pre-existing conditions like hypertension, diabetes, or thyroid disease before and during pregnancy is essential. These conditions interact significantly with pregnancy after 35 and require close specialist co-management. If you are over 35 and trying to conceive, the general recommendation is to seek fertility assessment after 6 months of trying, rather than the standard 12 months recommended for younger women. This is not because something is necessarily wrong. It is because time is a more significant factor. After 35, an earlier intervention leads to better outcomes. A basic fertility workup includes hormone levels FSH, LH, AMH, and estradiol to assess ovarian reserve, a transvaginal ultrasound to assess the ovaries and uterus, a semen analysis for your partner, and assessment of fallopian tube patency if indicated. If you are over 40 and trying to conceive, seek assessment immediately. Do not wait 6 months. I am Dr. Naomi Bennett. If this video is giving you the information your doctor never gave you, subscribe to Mater Nova right now and share this with every woman over 35 you know who is pregnant or planning to be. Until next time, take care of yourself and your baby.